Well, aloha and good morning. Thank you so much for being with us here on this Veterans Day. We, of course, want to salute all the men and women who have sacrificed so much for our country and our freedoms. We appreciate all of you for being here this morning. We join you, of course, Monday, Wednesday, and Fridays here on the platforms of the Honolulu Star-Advertiser. And today we have a guest from the Department of Health, Ryan, someone that we've really been looking forward to speaking with.
That's right. Joining us is the person who is sort of leading up the state's contact tracing program, Dr. Emily Roberson, joining us now this morning. Thanks so much, Doctor, for joining us and for being here. We know that you are very busy right now, but we certainly appreciate you taking the time this morning. First, want to just start off about asking you where we're at right now. Obviously, we saw a little bit of rise in the number here on the island of Oahu. What can you tell us about some of the things that you're discovering through this contact tracing that you folks are currently doing?
Hi, thank you for having me. I think I can say that we have a mix right now of some clusters that are associated with different types of workplace exposures primarily. And then the majority of our cases are really household transmission and also small events, people gathering with friends and family. It's still primarily community-driven outbreak, not so much associated with travel as of right now.
We'd love it if you would take us through the actual steps. So someone is identified as testing positive for the coronavirus. Tell us a little bit about what your team does when you're trying to control the spread of that particular case.
Yeah, so if somebody tests positive for COVID-19, then typically the way that the case is first reported to us is via an electronic lab report. And so that lab report would come directly into our data tracking system. And that's how we get the information about when they were tested and what their contact information was. We also get reports from their providers, and occasionally, sometimes people call us themselves to report that they've just received a positive test result. And from there, we have a first step, which we call the first contact calls. And so that's a triage and outreach system that will first call the individuals immediately and try to make sure if they, number one, know their test results, so know that they have tested positive. Typically, people are informed by their providers or whoever ordered the test for them, but every once in a while, people had not been informed by the time that we call them. So making sure that they understand what that means and that they know to notify their close contacts within certain time windows, and then also get information from them about specific types of exposure that would be requiring a very urgent response. And also asking if they have needs for social services or any other support services, making sure that they're aware of emergency danger signs when they need to call 911 and things like that. From there, depending on their responses to the initial interview, then we can filter them in a variety of different ways. And we have specialized investigation teams that do follow-up in certain types of circumstances. So for example, if we have a case that tests positive in a long-term care facility, we have a specialized response team of not only disease investigators, but also of infection prevention experts that can help the facility with infection prevention. And it goes from there. And depending on the specific circumstances, the follow-up might be longer and more intensive if it's somebody who, for example, is severely ill, or it might be just periodic or less frequent, and we might be following up on another side, like checking in regularly with the physician or with the workplace, depending on the specific circumstances.
How far back are you asking people? So let's say you're speaking to somebody who has tested positive. How far back are they looking at where they've been, where they've, who they've come in contact with? Is it just a few days? Is it a week? How do you know what period of, possible contamination that they may have caused to other people, and how do you determine that?
So there's actually two time periods that we're primarily concerned with. So the first one is the one that you just mentioned, if we're worried about them having spread COVID to other people. So that would be 2 days prior to either symptom onset, if they had symptoms, or specimen date, if they were asymptomatic and just had a positive test result that they received without symptoms. And sometimes in certain circumstances, we might go a little farther back, like with certain types of healthcare settings, for example. And that's really out of concern for that individual being infectious to others. But then when we're trying to figure out where that individual themselves contracted COVID-19, then that time period we're asking about is typically 14 days. And so that is really trying to figure out where they got COVID-19, not necessarily where they might have spread it to others. So sometimes that can be confusing, obviously, since we're asking about 14 days, certain types of exposures, and then we're asking about 2 days with other types of exposures. It might, people might not realize why we're asking different questions or slightly different questions about those two different time periods, but that's why.
We're getting in some questions just about the size of your team. I know that there was a lot of scrutiny about the program before you joined it. Can you tell us how many people you have actually doing this work? And, when you're talking about someone looking at 14 days, even 2 days, that you could have potentially so many contacts. How long does it take for you guys to usually complete a case?
So that would really depend on the complexity of the case. I would say the initial case interview that an investigator would have, not that first contact call, which is primarily about triage and getting them essential information and recommending for services. That initial call is typically around 20 minutes, but then the more in-depth interview, if an investigator has to follow up with them for specific reasons, that typically will take about an hour. We usually plan for 2 hours with charting, so 1 hour on the phone with the individual, and then another hour documenting in our system what they learned from that interview. And so currently, right now, I would have to pull up the exact staffing numbers, but basically we have a very unique structure in Hawaii right now that is actually not the type of structure that's being done anywhere else. So we have a system where we have 20 teams, and these teams have different special types of duties that they are charged with doing. So as I mentioned, we have healthcare associated infections teams and other specific types of investigations that we would do, but we also have teams for support staff. So I'm looking at our last week's numbers right now because I'm currently working on generating the staffing report for this week. And so here on Oahu, we currently have we have 311 people that are directly working on investigations, so case investigation or contact tracing on Oahu. And then if you count the neighbor islands, it's a total of 417. But those are broken up into different groups, and that's only counting the people that are actually working directly on the contact tracing and the case investigations. I'm currently working on a report that I'm going to publish periodically that has more detail about our staffing structure, and additionally the support staff, which are not counted in the regular numbers, but are really essential to the entire operation. And last count that I did about last week, I believe it was around 45 additional surge staff that we have in those support roles of directly supporting the case investigation and contact tracing, but not necessarily performing those tasks themselves. So the other thing that's important to note is that a lot of times when you hear 14 days or 2 days even, you might be thinking that we need to know every single person that you cross paths with. And that is really not the case. We're not seeing necessarily transmission happening in kind of incidental exposure settings. So really we're asking about specific types of activities over those 14 days. So we don't need to know every single place you went and every single person you saw, but we definitely need to know where you work, what your job is, when you were last at work, who you work closely with, and that sort of thing, if you're in certain types of professions. So if you, for example, work at a regular office where you're in an office by yourself, you don't have a lot of interaction with other people, and the interaction that you do have might be somebody stepping into your office and handing you some papers and leaving. That's not of great concern to us. However, if you work in a restaurant and the kitchen area is very small and it doesn't have good ventilation and you're regularly crammed in with 10 other coworkers, then that's a situation where we're going to ask you a whole lot more questions, and we'll probably contact your supervisor and maybe get a list of the people that worked with you, because that's of greater concern to us for disease transmission. So I think we've occasionally had people that don't realize that they've actually been investigated or contact traced. They'll say, oh, somebody from the Department of Health called me, but when am I going to hear from the contact tracers? And you did. That was the person that called you. And I think some cases, if people are very low risk and they don't have any of those exposures that are exceptionally concerning to us, they might get the impression that we didn't get a lot of information from them. And I think that what they might not realize is how much information we actually are getting that is relevant to us, and also the other pieces of the contact tracing and the case investigation. So knowing on our side, if this is the third person at that work site that has tested positive in a week, that might mean that we already have a whole lot of information about that work site and we're in regular communication. So I think that that's where it can be hard, because sometimes people will say, why do you keep calling me and asking me all these questions? And then other times people might say, oh, somebody called me from the Department of Health, but I haven't heard from, the contact tracers yet because they didn't request a full itinerary of every single person I saw in the past 2 weeks. And so it's really targeted to that individual's level of risk and exposure.
And so at your current staffing levels right now, is that an adequate number? Do you feel that you guys have a big enough team to handle what's the case numbers right now? And if those numbers were to, let's say, spike again, like we saw a few months back, is that something that your team can handle? Or are you folks looking for more support in this contact tracing division?
I would say that when we're looking at the overall numbers, then the overall numbers are not necessarily concerning to me. We actually have, just based on the numbers, capacity to handle a whole lot more cases than we actually have. And so when the staffing structure was designed, the target that I wanted to reach, specifically in terms of when I would feel more comfortable with our staffing levels, was based on a pretty crazy number of cases. One of the benchmarks that I set was I wanted to be able to comfortably handle 1,200 new cases a day. And in reality, if we have 1,200 new cases of COVID every single day, contact tracing is the least of our concern. And we've got bigger issues that are not necessarily going to be addressed by contact tracing. So that was a number that I had for planning purposes, but in reality, it doesn't make a whole lot of sense that we would actually need that specific capacity. However, what we're trying to recruit now is more specialized roles to fill in certain pukas that we have. So, you know, some support staff that we're still trying to get additional individuals on. And then also we have a Pacific Islander outreach and investigation specialist team. And we currently have contact tracers, case monitoring specialists, and investigators that are fluent in not only English, but also in Chuukese, Marshallese, Samoan, Tagalog, Ilocano, Cebuano, a whole host of different languages. But depending on caseloads, you know, we don't want to have just one or two people that is fluent, because if we get several cases that all need those language skills, we need to have 7 days a week coverage, and I want people to get breaks. So we're still trying to recruit for, you know, a part-time speaker of this language that can work Sundays to provide backup, and, you know, some kind of gaps that we're just filling in here and there. And it's primarily not so much about needs that are not being met. It's more about me making sure that the staff that's under my umbrella has the ability to feel comfortable taking days off and doesn't feel like they need to work long hours because they're only one of two speakers of a certain language.
You know, we like to bring in the audience. Ryan, at 10:43, Marie asks, tourists infecting hospitality and other workers, how can contact tracing be possible? So I know that you had said at the outset that what we're seeing really is community spread and not necessarily visitor spread, but there are a lot of concerns, especially with perhaps visitors not being as mask compliant as a lot of folks would like. So how are you dealing with, because tourists presumably go all over. That's why they're here. They're to visit a lot of different places. So how are you helping to contact trace those cases? Because we know that there have been a handful of those.
Yeah, in some ways it can be easier to contact trace tourists because they have more of a paper trail for recent events. So if somebody lives here and hasn't gone anywhere, then we might have issues with maybe an address or a phone number on file being outdated. But if somebody just arrived a couple of days ago, then the contact information that was provided with their pre-arrival test, for example, or with their coming in to the state is typically more up to date, and they're in some ways easier to find because they're in certain areas and we have a lot of buy-in and a lot of participation with the visitor industry. And I think that, there's other challenges. Obviously, it's not something where in a small state, we can benefit a lot of times from somebody knowing somebody else and saying, oh yeah, that person is so-and-so's auntie and they work over here, and then us being able to find them through our connections, especially when we're dealing with some of the specialized outreach teams. And we don't necessarily have those connections with tourists, obviously. So there's challenges and there's things that make it a bit easier. What I will say is that our biggest concern with tourists is some of those individuals that work in the visitor industry and that might have more ongoing or prolonged exposure with individuals. So tourists compared to locals don't necessarily mix within the community as much. So when we're seeing a lot of transmission taking place within households or at small backyard get-togethers and just kind of like the regular stuff that everyone in Hawaii is used to doing with like friends and family. When the transmission is occurring in that type of setting, tourists typically are not invited to the parties and, you know, are not necessarily hanging out in households with, you know, 10 people that they feel very comfortable around eating and drinking and doing other types of activities that might put them at risk. So the people that we would be concerned with are certain types of workers at hotels, for example, that might have prolonged ongoing contact with a tourist or somebody else, that just making sure that we're keeping the contact information up to date and checking that it works with the tourist, so that if we do have an individual with exposure to them here, that we can identify our resident with the exposure and can also find and follow up with the tourist. So those are some of our priorities there. And we do have a specialized investigation team that does focus on the travel related cases. And we have some individuals that have dual roles with different types of agencies that will interact with those individuals as well.
You know, I know that we only have a limited amount of time left, but I just want to quickly try to see if we can get to a few more questions. Kuniko is asking, what is going to happen with the contact tracing when the National Guard leaves at the end of December? We know the National Guard has been assisting in some of these efforts through CARES Act funding. Do you anticipate them sticking around and helping? Are they currently still involved in this contact tracing program? And what's sort of the plan once that CARES money runs out?
Yeah, they're definitely still involved, very much so. We're very, very thankful for the role that the Hawaii National Guard has played in this effort. They've been truly essential and invaluable. And I think that specifically here in Hawaii, we've tried out some new things that have not been done on the mainland that involve the National Guard. And I think that they're also showing, and I hope we're able to share with other jurisdictions, how we can use the National Guard as training them up to be kind of subject matter experts to really extend the efforts as well. So in terms of the long-term plan, then they are currently still assisting and they're playing an integral role. A lot of those decisions about what happens after December 31st are above my pay grade. So I have plans, you know, that the National Guard and I have been, and my team, we've all been working on in the event of several different scenarios. So we have the step down plan, we have maintenance plan, and we have variations in between. That we've been drafting, putting into place in partnership with the National Guard and all of our leadership at the Department of Health.
You know, I just wonder, before you go, because you get to see these cases, how they originate and how they spread, what would you say to the audience today? What is the riskiest behavior? What are the things that we absolutely should avoid? Because I think, you know, when we go out, like you go to the grocery store, you try to figure out, okay, when is it least trafficked? What activities are safe? What is not safe? What is sort of, you know, your advice to folks in terms of deciding how to behave, what activities to participate in, and what invitations to decline?
Yeah, I would say a number one thing I would say is that masks really are quite effective. And I was somebody myself that at the very beginning, looking at the research that existed at that time, I was somewhat skeptical about how helpful they could be. But now we've seen with the research we have now and just with the implementation of masking policies, they're actually much more effective than we had realized they would be. So that's a big point, I would say. The other thing that I would say is there's lots of concern about things like you mentioned with, you know, going to the grocery store or kind of passing people on the street and things like that, that are fairly low risk, that I will say for me personally are not terribly concerning. but people really let their guards down around their friends and family. And it's hard. I definitely know. I have a large family that are like hugger touchers. I'm worried sometimes that I'm out walking my dogs, I'm going to run into one of my family members and somebody's going to get a picture of them like giving me a big kiss on the cheek or something. And I definitely know how difficult that can be. But I think that people do have to keep in mind that COVID is just an illness. It's not something that has a value judgment associated with it. So just because somebody could potentially transmit COVID to you, it doesn't mean they're like an untrustworthy person. And that means that people who you love and trust and would never intentionally harm you can transmit COVID to you by no fault of their own or by no intention. So the vast majority of transmission that we're seeing is happening within households at these small gatherings. When we talk about occupational clusters, it's lunchrooms so much of the time. People will be wearing their PPE and very serious about it when they're doing their job. And then when they're on break, they go hang out with their work friends or they go take a smoke break outside. And when you're eating or smoking or just talking a lot and you have your mask off, that's the real risk of transmission. And so I think that people just need to keep in mind that in general, the greatest risk to them is going to be, and the greatest risk that they pose to others is to their loved ones and to their friends. And just regular everyday activities, kind of just pauhana type and backyard barbecue type activities, and then at work in the lunchroom, smoke break, that sort of thing. It's not so much running into somebody who recently traveled somewhere else that you don't know very well.
All right. Well, very informative, Dr. Emily Roberson. Thank you so much for taking the time to sort of educate us and update us on the state's effort. We know that it's been a crazy few months for you since you've been on the job here and kind of thrusted into this role, but we certainly appreciate you taking the time to join us on your day off as well. So thank you so much.
Thank you, and happy Veterans Day to everyone out there, especially all the veterans. Thanks.
All right. Thank you so much. Aloha.
Mahalo. Thank you so much. Wow, interesting to hear about that. We know that there were a lot of questions, and we tried to get to as many sort of broad topics as possible, but just the basics. Over 300 contact tracers now working on the island of Oahu. I believe she said 311, and then dozens more on the neighbor islands, along with a number of support staff who are helping them. Of course, they still have need for people who are bilingual, especially for the Pacific Islander communities where we've seen a lot of community spread. And interesting to hear that last question, answer that she gave, rather, about how she's not really worried about incidental exposure at a grocery store. She's concerned about having a few folks over, even in a backyard setting, even outside, and just getting a little bit too comfortable, maybe getting a little too close. And that's where they're seeing these clusters.
Yeah, I mean, just hearing sort of the context of what that process looks like, I think was very educational for people, because as she mentioned earlier on in our interview, and if you missed part of it, we encourage you to go back and watch the entire thing, because she kind of goes through the process of how they determine what they're asking these people who do test positive. And oftentimes people may think, well, they didn't really ask me a whole lot of questions. And a lot of time it's because they already have determined one, that they know the area and they have information about where you have been exposed. And sometimes you may have just a lower risk in terms of your engagement with others and where you've been exposed. And so interesting to kind of hear how they sort of navigate through that, and how, as she said, they're doing some things that no one else in the country is doing, of course, and utilizing the help from the National Guard as well. So great stuff there. I, again, encourage you, if you've missed any part of the interview or came in late, we encourage you to go back and rewatch the entire interview, as it was something that I think a lot of people can learn from.
Yeah, and one thing that's very concerning, and that she said is above her pay grade, is this idea that CARES Act funding does expire at the end of December, which is not so far away, and what happens to the resources that she has right now. Not just her agency, of course, we see this repeated in the unemployment office and different state offices, you know, all this CARES Act money, when that goes away, if there is not a CARES Act 2, what happens, and will we still have those 300 plus contact tracers? Will the state be able to afford that? So that's a big question mark, something that she is planning for. She says she has contingency plans for a number of scenarios, and now it's just waiting on you know, the higher ups, if you will, the folks in Washington, to decide what money will be available when. A lot of you folks asking about tourism and the cases there. We're devoting a whole show to tourism. That is on Friday. We're going to be talking to Peter Ingram from Hawaiian Airlines, who's a guest that we've had multiple times and always comes with a lot of information. That, of course, is our homegrown airline. And then we're also going to have Jeff Wagner from Outrigger Hotels.
That's right. We're going to just sort of get an update from them of what they're seeing on their end, not only in terms of volume and number of people entering, but also about what they're seeing in response to their employees and those who are potentially supposing to, you know, having to be on quarantine if those individuals are actually in quarantine for those 14 days. Some of them held up in hotels during that time. So, you know, be interesting to kind of have that conversation and get a check-in with them on how things were going since the state has reopened. And next week, we have another full schedule, which will include interview with Governor David Ige, as well as many others. So we want to encourage you to continue to tune in again every Monday, Wednesday, Friday, right here on the platforms of the Honolulu Star-Advertiser at 10:30. We thank you. We hope you all have a safe and joyful Veterans Day, and make sure to show your appreciation to those out there who continue and who have served and continue to serve in our armed forces. Until Friday, we'll see you then, and aloha.
Aloha.